episode with the Express channel. How you all doing? It's been 1 week now since we went on live. Hope you're all okay. So today we're going to be talking about the red list country. My name is Stella, and this is the Express channel where we talk about relocation, whether you are going as a student, whether you're going as a dependent, whether you're going with your family, whether you're going for work. We talk about it this in this place. So welcome to the family. Welcome to join us. If you're new to this channel, we say welcome. If you are a returning subscriber, we always say welcome. So let's get to business like we always do. We're going to be talking about the red list country, and like I always do, to always ensure we are all organized, we have the Bible. Yeah, the Bible that always guides us whenever we do all this sort of videos. So now, when someone is talking about the red list, what do we mean by the red list? And like we always say, before I start, I'm just going to connect with my second phone. Yeah, we have the second phone whereby in case you need more information, or in case so I can be able to see some questions that are being asked. So I'm going to be joining with my second phone. Yeah. Just give me 1 minute, please. All right, all done now. So what do we mean by the red list? What is this? Sorry about that. So what do we mean by the red list? When we say the red list, what do we mean? So the red list is a list that was brought up by the WHO. So the WHO continuously do something like they create a list every 3 years so that they can have a look at all the countries in the world and check out the number of healthcare workers that they have. And then they check, okay, the kind of service that is being rendered in those countries. Now, the purpose of why they do all this is to ensure that every country have substantial amount of healthcare workers, so that you don't need to, like, every healthcare worker is running away from their country, and then there's no healthcare worker that is back in their country to help those that are very sick, those that are very ill, and that's going to be a very bad thing in that country. Imagine there's no doctors, there's no nurses, there's no healthcare assistants, and there's no one to care for those that are sick in the particular country. What will happen to those that are sick? Because every day there must be someone that is ill. Like even today, there's someone that is ill in the hospital. I'm not wishing anyone bad, but it's just normal for there to be anyone that is sick in the hospital. Okay, so that's what the red list is. So they create this list to ensure that there's safeguarding. They created this list to ensure that there is support for people in the hospital. So today we're going to talk about this red list. We're also going to talk about what you can do now that there's a red list. What can you do in order to still get job? You understand? Because some people are like, oh, there's no red list, I cannot get job, what can I do? So we're going to be talking about this. All right, so this red list, again, this list they created, it's not just a red list. They categorized it into three. We have the green list, we have the red list, and we have the amber list. So what is this green list? This green list simply means, like they say, go. Means if you're a recruiter, you can come and take as much as, or if you're an agency, people can apply from their country as much as it means that if you're a recruiter, then you can come to a country, advertise that, oh, my country is recruiting, just like UK now. UK can advertise, oh, my country is needing healthcare workers, or you guys should come. And just like that, many people will apply. So they're like an agency, and then they will go. If you're on a green list. So what happened before 2020 was that we had so many agencies, we have MSL and so many of them. They normally come to Nigeria and other African countries. So they have a collaboration with the UK. So they advertise to bring in healthcare workers to the UK for this for this UK hospitals, and then many people apply through them. This agency at times are the one that even do the interview for these people. So once they are done with the interview, they just send them straight to the UK. They pay for the bills, they cover everything. So life was so easy, whereby you don't need to stress yourself, you don't need to go online and start applying. All you need to do is to get a very good agency, and then the agency sorts all that out for you. But during the COVID-19, about 2020, the WHO looked at some of these countries, and then they were like, something is actually going on. Some people really need, some countries active recruitment needs to stop. So that comes about the red list and the amber list. So the red list and the amber list was brought up so that there is no active recruitment coming from these countries. Now, everyone, listen to what I said. There is no active recruitment. It doesn't mean there is no recruitment, because we have what is called the active and we have what is called the passive. So there is no active recruitment in these countries, but there is passive recruitment. So what does active recruitment mean? It means that you, like how agencies normally have a contract with some of these, have a contract with the UK or with any other country. So when they have a contract with them, then they come to those countries to recruit people in large numbers. So that is called active recruitment, whereby agencies, or there's an intermediary that comes in to bring in people in large amount of people, in large amounts to the UK or to any other country. That's called the active recruitment. So it means there's no active recruitment. So instead of that happening, what we have now is called the passive recruitment, whereby the hospital advertise, you go to the NHS website, you go to the TRACE website. Once you get there, then they advertise their vacancy. So the moment they have advertised, you go and apply directly as a person. That's what you do. You go and apply directly, and once you've applied directly, then if you get the interview, you perform very well in the interview, and then you get the job, and that's the difference between you and them. So once you've gotten the job, then you come to the UK. Unlike before, whereby there's massive recruitment. At the moment, we have some countries that are still having active recruitment ongoing, and that's what, and they're on the green list, sorry. So those are people from India, people from Malaysia, people from the Philippines, people from Sri Lanka, anybody from that country, and you are on this live today, you don't need to bother yourself, because all you need to do is to apply to an agency in your country, and then there's active recruitment coming down to you. But if you are from these other countries like Ghana, you're from Nigeria, you're from Pakistan, you're from Rwanda, you're from Zimbabwe, you're from Guinea, so many other African countries, you are on the red list. And this means that agencies cannot come to the UK to recruit you and bring you in large amounts down. Sorry, yes, I'm bringing a large amount to the UK. So what you have to do is you have to be applying directly by yourself. What of the amber list? What does this amber list means? Because we know about the green list and you know about the red list. So what possibly will the amber list be? Well, the amber list is similar with the red list. Yeah, it's similar. It's just that the difference is that once you are on the amber list, it means your government have had a government to government interaction with the UK. I say, okay, yes, I know I'm on the red list, but let's have a collaboration. Let's do a pilot study. So we have Nepal at the moment. Nepal government have signed a contract with the UK. And then in that contract, it states that people from Nepal that are applying to work as a healthcare worker in the UK, the agreement states that they can only go to a particular trust. That's the agreement between them. So they are doing like a pilot study. A pilot study means that it's just a trial and error at this stage to see the effect it's going to be on their country. That's what it's been. It's the effect it's going to be on their country. So it means that anybody from Nepal, if you apply now, you can apply with an agency. They have an agency that is going to recruit you only to that trust. But the backdraw of this effect is that people from that country cannot actively be recruited into any other trust. So any agency, if it's not that trust, no agency can come to Nepal and take people in large amounts. So if you are coming to take people, it has to be sent to Nepal. But if you are from Nepal and you want to, if you're from Nepal and you want to apply to the UK and you want to go to other trusts, that is not that particular trust or that particular hospital that agencies are taking people to, then you have to apply directly by yourself. So you see, it's kind of similar. The red list and the amber list sounds alike. The only difference is the government to government contract. Anything outside the government contract for an amber list, anything outside it is known as, it's against the law of the UK. So if you are doing any active recruitment, you're an agency, you're going to Nepal, you're going to Kenya to take people who are, because Kenya and Nepal on the amber list, and you're going to take people in actively, you're an agency, you're going to take people to other trusts, you are doing something against the law. But if you are taking people to that particular trust as in the agreement, you are safe. Okay, but if you are from that country, you can also apply to all these other countries directly by yourself. Whereas in the red list means that nothing like active recruitment, nothing like that. You can only apply directly by yourself to the hospital, and then once you satisfy the hospital requirement, they recruit you and you go directly. So that's why at times you will see only one Nigeria coming in a cohort, you will see just like two Nigerians coming in a cohort, or you see one Ghanaian coming in a cohort, because the active recruitment is not ongoing at that moment. Okay, now who does this affect? Which people does it affect? Does it affect anybody? Does it affect everybody? Who does it affect? Who is this referring to? Well, it refers to people working in the healthcare sector. That's what it means. It refers to people working in the healthcare sector. So if you are a nurse, if you are a doctor, if you are a healthcare assistant with this carer work that is ongoing at the moment, if you fall in those category, if you are a social worker, if you work, so long you work in the health field, or you're a radiographer, or you are a physiotherapist, so long you work in the health field, the paramedics, it means you are, this red list is affecting you. But if you are not a healthcare worker, this red list does not affect you. Now, so we ask me, why is that? Why is this red list affecting those people that are healthcare workers and is not affecting those that are not healthcare worker? The answer is very simple. It's the fact that WHO is called what? World Health Organization, and they are concerned about what? The health of the people in the world. That's why it's called the World Health Organization. They are not concerned about every other field, they are concerned about health. And the list that is being drawn is not drawn by individual countries, it is drawn by WHO. That is the difference. The list is drawn by WHO and is directed to the world in order to protect the less people, the less country, the less privileged country. You know, we have what's called the less privileged countries, and we have, that's the developing or the underdeveloped country, and then we have the developed world, so that the developed world is not just going to come and take advantage of the developing world. So that's why the WHO created that list. So because of it's the WHO that created the list and not individual countries, it's only affecting those that are from the health field. So if you are a technology person, if you are if you're a technology person, if you're a teacher, if you are into other fields, you're a driver, you're a baker, you're a plumber, you are into research, you're coming through education routes, you're a student, it doesn't affect you because you are not a healthcare person. But if you are coming as a healthcare worker, you are being affected. So sorry about this. Yeah. Okay. So when that is being said, how often do they review this? How often do they review this law? Every 3 years. So now it was being reviewed. The last time they reviewed it was 2020, and then they reviewed it again March 2023. So the next time they are possibly going to review it again is going to be 2026. And though there's something you guys must know, that this is not a permanent thing. It's not permanent at all, because every year it's either they remove or they add. So as of last year, or as of years ago, that's 2020, Zimbabwe, I don't think was on that list, but now they've been added to the list. So you can see if you fall in that category, maybe you will just be praying now, oh my God, oh my God, oh my God. Maybe 2026. Let's say you're a student now that joined us on this live, and you are from this country that are red list, and you are due to graduate 2026. You can start praying now that from 2026 your country will be removed from the red list, and once your country is removed from the red list, then you can come, or you can sign a petition. There was a petition ongoing, like they were saying, oh, they should sign Nigeria off the red list, but the fact is Nigeria and Ghana, their regular customer, they are always on that red list. But the thing is, people are still coming to the UK despite that. Like 2020, I came to the UK around that time, and the red list was already formed. So if I can speak to you, and I've been in the UK, it's just a matter of 2 years now, I'll be getting my permanent residency. How about you? You can also come. I understand the fact that red lists also make things very difficult for people to come in numbers, because you can see people applying for years, applying for like months, applying to jobs, and they're not getting. A lot of people are complaining. But the thing is, don't give up, okay? Don't give up. So I'm going to be telling you now, if how can you apply? That's the next thing that we are going to talk about. What can you do, since they said that you are on the red list? What can you do in this situation since you are on the red list? Okay, what can you do to resolve this thing? Number one is what the popular thing we always say is apply directly. Do not give up, because of recent, the reason why I actually did this video is that of recent I've been getting so many messages on my WhatsApp, and they were like, oh, I'm on a red list, so my country is on a red list. It means the UK is not actively recruiting us again. And I'm like, no, my dear, it's not like that. That's not true. Who told you that? The UK is recruiting you guys. It's even stated on the website on the UK. I'm going to be dropping, because after this video, after this live that is ongoing now, I'll have to wait for it to get uploaded. I remember the last live we did, some people were complaining that we didn't put the express Gmail as we stated we were going to put it there. It's because after the live, I can't just go and type. I have to wait until this live is being uploaded. Then I'm going to edit it and put some information that I stated I'm going to put during the live section. So after this live section, I'm also saying it now, that once it has uploaded, I'm going to add the link of what I'm talking about, so you yourself can go ahead and review it and see if there's anything you want to be clarified about, because some people learn by listening, while some people learn by listening and by reading as well. So I'm going to be dropping that and adding it to the description, so you can watch it through the moment after this live. Okay, so now what can we do, since since our country is on the red list? Like we always say, apply. You have to apply directly. That's number one thing to do. You have to keep applying to different trusts. If you go to website, like if you are since I'm talking to healthcare persons now, so if you go to website like the NHS website, that's the NHS job, create a Trick account for it. If you go to website like NHS Scotland, NHS Ireland, if you go to website like care home, no, that's for healthcare assistant, now carehomes.uk. If you go to website like Total Jobs, even on LinkedIn, even on WhatsApp group, once you see any vacancy, you apply directly. Don't just sleep on it. Don't give them a breathing space. Keep applying. Apply. Another thing you need to do is to ensure that now you're on a red list. You have to ensure you stand out from the others. Yeah, that's what you have to. You have to ensure you are standing out. So number one thing they do, all these recruiters do, is the supporting information. At times they don't have time to go through all your many job roles. Now when you are creating your CV on Trick, you see where they will tell you where do you work in and all that. They might not have time to go through all those things one after the other. So it's your supporting information to look at, and that is your selling point. So you need to sell yourself to them. You know what it means, sell yourself to them? You need to sell yourself to them. So you need to, when you see a job application, you go through the job description, you go through the job specification and see, okay, they're looking for the role of a nurse in surgical. I have an experience in accident and emergency, but I haven't worked in surgical before. How do I marry my supporting information so that it will sound alike? Because I work in accident and emergency, but this is a post for a surgical. I want to come to the UK, but I don't even mind the particular place I'm working, whether it's an emergency, or I even want to change to surgical because I am tired of accident and emergency. How do I create my supporting information now to suit this application? So what you can do is you will say, okay, once you've introduced yourself that, okay, I'm a nurse that I've applied in this, but I'm a nurse, I've been working for this particular years and I graduated from this place. That's number one. And number two, you will state that I currently work in accident emergency, and this accident emergency have allowed me to take care of so many numerous cases. We normally see patients with different surgical ailments, and yeah, with various surgical ailments, and you list a few that you've taken care of. And with this experience, I've been exposed to know how to take care of surgical patients. Do you understand? It already means that you are aligning with what they are requiring. And then it doesn't mean that because you don't have experience in surgical field and you only have experience in what are they calling it, in A&E, you cannot apply for the job. So long you can marry the two together, you marry, then you now state how your strength and you highlight your strength. And what I normally do or encourage people to do is, that part that you feel like is going to be catchy, try to put it in capital letter, so that even if the rest are in smaller letter and that part is a capital letter, it gives you an edge. So once I'm just glancing through at a glance, I can see the strength you have, and I see, okay, in the job requirements, it's also there. So it means that your part, it means that your it means that you meet their specification, and then the recruiter or they're going to grant you an opportunity. So this is how. Let's take another scenario whereby you are working in the medical field. Okay, they're working in the medical field and they need an experience for accident and emergency. Okay, they are working in the medical field, but they need an experience of accident and emergency, and you don't mind working in accident and emergency. So what you can do is, so it's just the same thing. Once you've stated, like, okay, you are a nurse for so years, you've done, and then you stated, okay, you've practiced that, and you stated where you graduate from, then you begin to highlight that you've taken care of people in with different medical ailments, and you know that working in accident and emergency, they are going to be requiring you to have knowledge of medical disease. They're going to expect you to have knowledge of medical care, and because of your experience in the medical field, this enable you to be able to take care of these people. You are also one that is open to learning, and then you keep putting, and you have undergone different training. Let's say you are someone that have gone for a research, or you are someone that has normally go for seminars in your hospital. You say you are someone that is open to learning, and so that is why you normally go for this seminar, go for this presentation, or if you've even done a work before, you state it just like that. It kind of helps to boost your chances between people. So and the moment they look at your application, it also gives you an edge, and once it gives you an edge among others, then you'll be able to be granted an interview. Another thing you need to do is to ensure that moments you get that interview, take it like a gold mine. You need to take it like what? A gold mine. Of recent, my company were doing interview with some people, and then there's something I really observe is that some people don't really know how to go for interview. They say, tell me about yourself, and then some will just say, okay, my name is this, I'm a Christian, I work. Some people will not even say where they worked. They won't even say where they study. They won't even say what they do. They'll just say, I'm a Christian, and one or two things, and that's it. They don't say anything anymore. My God, how can you do that? This is a gold opportunity. If you see where the UK are submitting their application and talking about themselves, it's like this. The application, when they were doing paper application, it can be so big because they will write into details everything they have done. They will write into details everything they have done. So imagine they've given you a job interview and they say, tell me about yourself. You will have to tell them about your education, tell them about your, when I mean education, I don't mean from your primary school. I mean your university undergraduate degree. You tell them about your work experience. Don't just even say I've worked 20 years in this field. You need to say the specific words you have worked in. If if you are working accident and emergency, you need to demonstrate that. Apart from demonstrating that, you need to make yourself stand out from other people, because every other person might be saying, yes, I've worked in this field, I've worked in accident and emergency, I've worked in medical. How do you make yourself stand out? You give scenarios, you give example, you give, oh my god. So, but yeah, it's when I talk about this, I talk with passion, because I know like how when I give people all these tips, most of them come out successful. You give example. Oh yes, I've worked in in the medical field where I took care of these cases. I've also, I'm very diligent, and a patient of mine gave an exam. Gave my hospital, like told my ward people like about how good I was, and then they gave a card complimenting, oh, how I won an award in the world. Like, you give different scenarios. If you talk about how you have good communication skills, how you have good interpersonal skills, you talk about how you are flexible, you give little examples of how you've achieved all that, and that makes it stand out for you. You understand? So these are ways you need to ensure that your job application is good. Apart from that, the most ultimate thing of them, or if you haven't gotten anything from this first point I made of job application, is the only, if you haven't gotten anything, one thing I want you to take away is your consistency and your frequency of your job application. You need to keep applying. Like, do not give up. Do not, I know some people will say they've applied to like 200. Please, I'm begging you, do not give up. Okay. Now, what is the other option? Number two option is you can go to another country. I know some people will be like, what does she mean? Well, there's something I want to let you know. We have countries like, we have South Africa now. South Africa is not on that list. If South Africa is cheap for you to go, you can go there. You can check on that WHO country, okay? That list, that WHO list, you can check it, and you look for countries that are not on that list. And then if you have a family member, you can go there and visit. I have a friend. Let me give you a live example. I have a friend that went to Dubai. I know right now Dubai are not taking some Nigerians, but there are also other countries. Like South Africa has opened their doors to Nigeria. I have a friend that went to Dubai. She stayed there with her family member for about 6 months. So while she was there for 6 months, there were agencies that were taking people in massive recruitment, because agencies cannot take a massive recruitment from Nigeria, but agencies can take a massive recruitment from Dubai. So it means that it doesn't matter when they say the red list doesn't affect, it's not about where you did your degree from. It's not about that one. It's about where you are currently living. That's what the red list is about, where you are currently living. It's not about where you did your degree from. So if you were a doctor or you were a nurse and you were trained in Ghana, you were trained in not India now, you were trained in Ghana, you were trained in other countries that are on the red list, and you went to this other country, you've been there for a while, you can apply directly through agency, and then you'll be recruited in massive amounts, because it's not about where you got your degree, it's about where you are currently living. That's what it's all about. So you can go just like that. My friend, she schooled in Nigeria and she was a nurse. She went to Dubai and then she was recruited through agency among the massive people, and they recruited loads and loads of them were being recruited to the UK, and they came in large amounts. But these people trained back home in Nigeria, but they were in another country that was not on the red list, and they were being recruited by agency. So this is another way you can this is another pathway you can follow, so that you won't just stay at home and then you are worried like, okay, what can I do? Just simple, go on the red list. It's just on the like I said, I'm going to drop the link anyway in the description, so you can just click on that link and check which possible country can I go into now. Even if I can stay there for 6 months, if I have any family member, even if I can stay in a hotel for 6 months there, and but make sure before you go, you must have contacted an agency, or at least know about an agency that is there, so that you don't just go there and that's when you start finding agency. No, don't do that. You might just end up wasting your money. But like these other countries, now you can go there, like even in South Africa, they bring them in large amounts. Go there. You don't plan to stay there, so you're not bothered about what they are doing there. Just apply to the agency and join the recruitment. Especially, you should only take this path, especially if your CBT, your IELTS is going to expire very soon. and you are worried that you have to start all over again, because it can be very painful to start all over again. If you fall within this category, then please try to take this route. Okay, now what is number three? Number three method is you can self-sponsor yourself. I left this one for the last part because I know that not everybody can financially sponsor this. Remember in my last video, I stated that, oh, you can come to the UK using the visitor visa, blah, blah, blah. And then I got some people, they were like, tell me about that. But then we ran short of time. I couldn't talk about it. I couldn't explain what I mean by that. So today, I'm going to talk about and explain what I mean by that. It simply means that you can self-sponsor yourself through a visitor visa. If you're a doctor in this place, you understand what I mean by that. You understand what it means to self-sponsor yourself. So you can self-sponsor yourself. You apply for a visitor visa while you are in the UK. Sorry, not while in the UK. I'm sorry about that. You can apply for a visitor visa while you are in your country, whether it's Nigeria, whether it's Ghana. You apply to UK for a visitor visa. The UK has allowed nurses and they have allowed doctors to come to UK for 6 months to write an exam. So while you have passed your IELTS, you have passed your CBT, and all you have left is for you to come to the UK and pass your OSCE exam and get your PIN. Same as a doctor, you have passed your PLAB 1. All you need to do is to come to the UK and get to do your PLAB 2, and then you get the job. So the moment you are able to pass this category, and then you know that you are at the stage of just waiting for a job to bring you to the UK so you can pass your OSCE, you can instead take the path of sponsoring yourself. Apply for a visitor visa. Once you've applied, you submit all your documents. You need to submit your travel you need to book where you're going to stay. Or if you have a family member in the UK, they need to write a letter stating to the UK that they'll write the letter and give to you. Yeah, because you're going to upload this on your application. So they're going to state that you are coming to stay with them during your stay during the UK. And then so you're going to book your flights. We've done a video on visitor visa anyway, but I'm still going to talk about it. You're going to book your flights. So your flights, you're going to be booking your going and you're going to be booking your returning. If you don't book your returning, they won't let you to go into the UK the moment you get to the visa office. So you will book your coming and you will book your returning tickets. You're also going to ensure that you have enough fund to stay with you have enough fund in your account that is going to last you for that period of 6 months. So you need to go to the gov.uk website and check out visitor visa and check the amount of money that you need to have in your account for that period of 6 months that they require you to have. So you need to have that money in your account, and that money is supposed to cover you for 6 months. So the money, like we always say, must be in your account for 28 days or at least a month. But that amount must be the one that must be in your account for that period of time. Now you need your bank statements. You need your bank statements so that they can see the money in and all that, and ensure that it's safe. And then you also need, it's going to serve as your proof of address to know that yes, you are someone that is legit, you are not a fraud and all that. So those are the minimal things that you need. And then probably state why you're coming to the UK. They also need to see that you have booked your exam too. They want to see that yes, you're actually coming for an exam, so you need to book your OSCE even before coming down to the UK. And that is also good for you because you can stay at home. Once you are ready you've practiced for the OSCE, you are confident in passing the OSCE exam, you just book it, you get your visitor visa, you come to the UK, continue practicing for like a month or 2 months, you pass your exam. The moment you pass your exam, you start applying. And the moment you start applying, it will just amaze you at how much people they are going to be rushing you. Why? Because the UK needs nurses. It's just the fact. The UK needs nurses. Like every day. If you are following the UK news, you can also see that nurses, doctors, and other healthcare people are striking. Now, why are they striking? It's because there is not enough staff. There's an required amount of staff that they need people to have. So it doesn't matter whether you're from the red list or not. The moment you get your license, you can be able to to give you an edge. It's not as if the red list will not affect you, but it will give you an edge. And the UK will see that okay, we don't need to sponsor this one, so we can bring them. We don't need to they need to sponsor you, but we don't need to pay for exam fee again and pay for many things, training. So this one is going to be less costly for us, so we can bring the person because this person already have a UK license. And they will also see that you took the pain of coming down to the UK to be able to take the exam by yourself, and they'll understand how serious you are, and that's how you are going to be able to get job in the UK. So this is another part you are going to take, and it's going to work for you. Now I have different scenarios that's stated by the WHO, just in case you have some questions or this red list is not still clear to you. And I'm going to be opening the different scenarios so we can go through the red list officially by the NHS. We're going to go through the red list. So they have different scenarios, and I'm going to be going to scenario 1. It's just so that you can understand what they mean by the red list and understand what you can do and what you cannot do by the red list. So what is scenario 1? Scenario 1 is an agency advertises within Togo. Togo is a red list country and actively supports several candidates resident in that country with their applications, appointments, and their travel to the UK. Is this legal or is this not legal? Remember, if you are acting against the red list rule, it makes it illegal. This was the answer they gave. They said this will be deemed as an active recruitment and contravenes the guiding principle within the red list code. So what does this mean? It simply means that Togo, which is under the red list, this agency came and they took them. They came to advertise their stuff in Togo, and then they brought people in large amounts, which is against the red list law. The red list law stated that you should only apply directly if your country is under the red list. Okay. Now, what is the next scenario? The next scenario states that a nurse that resides in Sudan, which is a red list country, she makes a direct application to a job advert on the NHS website that the nurse on her own went to apply unassisted, and then she's interviewed by the trust, and they stated that she qualified to come. They grant her job offer. Is this against the red list law? They said no. So long this activity does not involve active recruitment, she applied directly by herself, it was a passive one, it definitely means that it's not against the red list law, it is within it, and it is approved by the WHO and approved by the UK. Let's take another scenario. I have about 3 to 4 more scenarios, so just stay with us so we can explain so you guys can understand. So the next scenario states that a doctor from another red list country is currently staying in Canada. He has relocated there for over 5 years. Now, he has been in this country for 5 years. An agency advertises in Canada, and the doctor is recruited in a cohort massively with this agency. The doctor is being recruited. Is this against the red list law? And they stated no, that it is not the red list law, because red list is determined by the country which the individual is being resident in, and not the nationality of the training. It's not by their nationality or neither by their training. So the WHO is saying that on no account should the country, let's say you now apply directly by yourself or you are following within their rule, they will not say because of your nationality they will not take you. It's called discrimination. It is called discrimination. So they are not allowed to do that. So long you pass their interview, they are allowed to take you. If not, they are committing a crime, which is called discrimination. Now, what is the next one? Scenario 12 states that a social worker resides in Chad, which is a red list country. The social worker then makes a direct application to a specific vacancy advertised by UK, all right, and is successfully appointed. The local authority requires the support of an agency to facilitate the social worker through the remaining of the recruitment process. Now, I want you guys to look at this scenario very well. It's a very delicate one, because I'm going to have a lot of people asking me questions now with this particular scenario. So it's, for example, I, being Stella, I applied to UK to pass for job. I applied directly. I've passed the job. I've been granted the job offer. So now we have an agency who is in the UK that helps to facilitate. Let's say I don't have money to pay for my visa, I don't have money to pay for my flight tickets, I don't have money to pay for my accommodation. I then contact an agency, and this agency work in connection with the hospital. The agency then helps me to come to the UK, pay for my visa, pay for my flight, pay for everything I need. Is that against the red list law? They said no, it is not against the red list law. You are allowed to do what you are, the agency, you are allowed, and the agency is allowed, so long during the recruitment stage, that's part of that job application, you are applying by yourself, then the answer is no. The moment you've gotten that job, agency can help in facilitating any other thing. They can help you in bringing you to the UK, sorting your accommodation out, helping your family and all that, because that was what they were doing before. Yeah. So apart from the job, the moment you've gotten the job, agencies can then come in to assist you. Now, what is the last scenario? Okay, the next scenario is an NHS trust that is part of an NHS collaboration hub put out its own advert for a mental health nurse position, and then the advert is not targeted at any country. The NHS received 250 applications and applies and appoints a mental health nurse from a nurse resident in Ghana. Is that against the law? It's not against the law, because why? The NHS trust put an application for anybody in the world to apply. You are interested, you went to apply for it. Once you've applied for it, you got it, and after getting it, simple. They didn't like, the NHS trust didn't say, oh, everybody in Nigeria, everybody in Ghana, you come and apply. No, they put it out for people. You saw it, you were interested, you applied, and then you came. So it was very, very simple, straightforward, direct, and then so it's not against the red list rule. Now, what is the last scenario? The last scenario states that a social worker puts out an advert, a social work provider, puts out an advert for a number of staff to fill various specific vacancy with its own nursing home. The advert is not targeted at any country, okay? It's not targeted at any country. The provider receives 60 applications and appoints 3 senior care workers residents in Philippines, okay, and then another 3 of them residents in Nigeria. Is it against the red list rule? And they said no, it is not against the red list rule. Why? This is because it was put out on the open, and then the Nigerians, they applied, and the moment they applied, even if it's 5 Nigerians that applied and they brought all of them because they passed, it's allowed, because the process was that. What process did they use to get that job? You applied, the other one applied, the third one applied, and they applied directly. They did interview and they passed. So they are allowed to come to the UK using that route. So these are the rules that are guiding the social media. So these are the rules that are guiding what red list recruitment, and they've explained everything here. Now, what are possible questions and answers before I leave the room for other questions that might come in, or be reading through my question and answer on the live section? I'm going to be looking through questions and answers that, I'm going to be looking through questions that were being asked in various WhatsApp groups and were asked to me directly as well. So what if I keep applying and I keep getting rejected? What do I do? The only thing you can do is to keep applying. You need to keep applying on, or you take the other pathway which I've talked about. You can decide to replay this live section if you joined us late, so you can understand what we have talked about already. We have talked about the paths you can take. We talked about 3 unique paths you can take. So if you keep applying and you're not getting it, then you can take the second option, or you can take the third option. Now, what's the next one? The next one says, can I use an agency? You can only use an agency if you are from other countries that are on the green list. If your country is on the red list, you cannot use an agency. The only time you can use an agency if your country is on the red list is after you have gotten the job. You can use an agency to bring you to the UK and pay for all your expenses and all that. But before then, you cannot use an agency. No, you can't use anyone. Or you can go to other countries that are using agencies and join them and come to the UK. Then the next question is, Does red list affect other professionals? No, it doesn't affect. We've talked about this already. Red list does not affect other professionals. The last one is red list permanent? Does it mean that there's no way forward? There's always going to be a red list. Like I said earlier in this live section, I stated that the red list is going to be reviewed every 3 years. It's going to be reviewed every 3 years, okay? And then it was reviewed this year, 2023, and they added other countries to the red list now, making it 55. So who knows what will happen in 2026? Hopefully, other countries become, or our country also become very good, so they can take us off the red list and we'll be free to do whatever we want to do. Now, if you have any question in the comment section, please, or if you have any question in your mind, please drop it in the comment section, because now is question and answer stage. I always reserve this for the last so that we can answer any questions. So guys, I'm going to be going through now. Do you have any question, anything that is bothering you, you want to know about? Because it's a live section, it's not just only me talking. So if you have, in the next few minutes, can you please drop it in the comment section so we can give you the answer, anything that is bothering you. And it might not also be related to this red list, but let's say you have a big concern, maybe about a study visa, or if your family can come with you, how can your family come? If there's any law, you can drop in the comment section and we are going to answer the question for you. All right, okay, I'm going through now. Do you have any question, guys? None? Have I answered all your question? Well, that's good to know, though, that I've answered all your question. Okay, let me give the next 2 to 3 minutes. Let's see. So we have, yeah. Oh, yes, that's what I mean. I mean, like, an individual cannot use an agency to apply. So, do you mean an individual cannot use an agency to apply since you're on a red list? Yeah, you cannot use an agency to apply. So long you're on a red list, you cannot. But if you are in another country and that country is not on a red list, yes, you can use agency. But if you are on a red list country, you cannot use an agency. Thank you so much. Okay, how many minutes more? 1 more minute. Ask your question now. Don't come and ask me later on the Telegram group and say, oh, I forgot to ask it now, so we can attend to it. Anyway, if you haven't subscribed to our channel, it's time to do so, because we normally if you haven't subscribed to our channel, it's time to do so. We want you to hit that like button now, because we normally do these sections, and we normally ask help you guys to sort most of your relocation questions, relocation worry, and all that. Oh, the questions are coming, my god. Okay, thank you. Anyway, yeah, so if you haven't subscribed to our channel, please try and do so. Like and subscribe so we can give more information like this. Another reason why we always encourage you to subscribe and to like the video is so that it can be shared towards other people and other people can see it, because the more you like the video, the more YouTube is going to enable other people to get this information. If not, people are not going to get this information and people are not going to know what they do if they find themselves in all the situation. And the one thing you don't want anybody, or you don't want for even your worst enemy, is what you don't want is ignorance. Ignorance kill. Even Bible said ignorance is not good for anyone. So ignorance really is not good for anyone. So let's have a look at the live chat that is ongoing. It says, how do I get in contact with the agency that is not on the red list? Well, you need to go to, all these countries. If you're someone that has family members in Dubai, you have your friends in Dubai that are working, because at times, if you're a country that's gonna, you see where people are saying Dubai are recruiting nurses, you can contact them, because definitely it's going to be going around in their it's going to be going around in their group or in their hospital, where they are talking about, oh, these agencies are coming to recruit people to go to the UK. So you can as well just contact them. Or another thing you can use to get this information is by checking through LinkedIn. LinkedIn, you will see, once you just search for recruitment agency from Dubai to the UK, you will see many of them. We have those agencies, they advertise, because even them, they are looking for people. It's a business for them, so they are not hiding themselves. So you can always check through LinkedIn. Another place you can check through is Facebook, but always confirm, because we have got some scammers on Facebook. But you can always confirm through Facebook agencies that are recruiting through all these other countries. Even South Africa, you see some agencies advertising, oh, apply to UK as a nurse. So once you go to this country, you can even contact them for why you are in Nigeria, or you are from Ghana, or in other countries. Contact them, and then once you get to that country and you stayed like for maybe 1 month, 2 months, or 3 months, they can put, before they process all your stuff, even before they have processed everything. Why we always say you should stay at least 1 month, 2 months, 3 months, so you can get at least some bank statement to show that you've been in that country. But nevertheless, once you've stayed in that country, whether you get a bank statement or not, and you apply to through those agencies, they can bring you down to the UK. Another way you can find these agencies through telegrams. You can get them through telegrams, or Facebook and LinkedIn. That's my most preferred one. I can always tell you, they are always there. Just search for them and you will get them. Then the next question is, how do I get, I've seen that, okay, for the self-sponsorship, do you know how much it's costing? Or for the self-sponsorship, okay, that means I'll save that for the last question. Okay, let me see if there's any other person asking. Do you know this cost of self-sponsorship? So let's do this together online. Let's go to how much a visitor visa costs, because we have to break this down, right? So visitor visa costs UK. We're going to be looking at the cost of a visitor visa. Now they said a standard visitor visa costs £100. Can you imagine? £100. If you're looking at black market, it's like 92,000 naira at the moment. So it costs £100 for up to 6 months. The earliest you can apply is 3 months before your travel. I'm not saying it's like, I'm just giving you one aspect of it. So yeah. So you can go to gov.uk website and read more on this visitor visa, so you can check the eligibility and you can check how much you need to have in your account. So in all, let's do a total. So you need like £100 to do your application. That's number one. You need to book. If you have a family member, then this doesn't affect you. But if you don't have a family member in the UK, you need to book for an accommodation that will last you for a period of 6 months. So that's one. Depending on where you get the accommodation, I don't always encourage people to go to London. I prefer you to go to other places. Like, you can even go to a cheaper place and stay. When it's time for the exam, you now go to Manchester or these other places for these exams. So you can go to the northern part, whereby for a night costs as low as £25 for a night. So you can calculate how much and how long you are going to stay during that period in the UK. So once you've calculated how much, that's number two. Then the cost of the fee. I think the fee of OSCE exam is about 300 and something pounds. I stand to be corrected because I haven't browsed it yet. So I think it's about 300 and something pounds for the cost of let me even check for you. Cost of OSCE exam. The cost of OSCE exam, the fee of us for the OSCE. Oh my God, I'm sorry. The fee of the OSCE is £794. That's the fee of the OSCE exam. Their fee is £794. So once you check £794 plus £100, that's £894. Then the hotel fees vary depending on where you are going to stay. So once you've calculated the hotel fee, you add it to your, let's say about £1,000. It should reach £1,000 though for 6 months, or even more than, depending. Because 20 times 30 is like £600 in 1 month. So when you calculate it and you see how much it's going to take you to stay in the UK, you can decide to stay for a shorter period. Once you stay for a shorter period, then go back to Nigeria. But it doesn't matter so long you have that pin. Even if you go back to Nigeria, you are going to get job. So that pin is the only thing that is holding you from getting constant job. The moment you have that pin, within 2 months you see yourself back in the UK working as a nurse. So that aside, so when you check the amount of money for your hotel bill, depending on where you get the hotel accommodation, then you also calculate your feeding that you're going to put in. Then you calculate your transport. Another way you can do with that transport is try to book ahead. Like, let's say you book about 8 months or 6 months ahead. If you plan to do, you can book 6 months to 8 months ahead for your flight tickets. So for your flight tickets, it makes it very, very cheap. So instead of you to be getting your flight ticket that is very, very expensive, your flight ticket is going to be cheaper if you book quite ahead of time. And then I always recommend booking Qatar rather than British Airways, because British Airways, although they are very good, but they are very expensive. So the moment you book either Qatar or you book Turkish Airline or Ethiopia Airline, those are my three recommended airlines to book because they are cheaper. But if you want more of standard and uniqueness, British Airways. But if you don't, you're spending so much already, just to cut your costs, book those other airline. So once you book them and you've calculated the amount of money, it might reach up to £3,000. Let's just roughly say 3,000 to £4,000. So if you have that money, you can sponsor yourself in the UK. And to tell you the moment you come to the UK, you make more than that within 2 months or 3 months. You've covered. If why I'm even saying 2 months to 3 months is because you have other expenses you might want to cover in the UK, maybe your house rent and all that. But within 2 to 3 months, you've made that money back, and it's something that it's very good. So if you can sacrifice 3 to 4 million naira, or 3,000 to £4,000 for those that are not Nigerians, then you can be able to sponsor yourself to the UK. Is there any other question? If not, we're going to call it a day. Do you know the course? How do I get? Okay. So I believe that I've answered every other question. So thank you so much for joining us in the live section today. I'm sincerely grateful for your time, and I don't take it for granted. Don't forget to always like and to subscribe to this channel, because you are going to get more information. If you are joining late, try to watch the video from where we started so you can get more information. Share it to your family, share it to your friends. If you are sharing it, you're not sharing it because of me, you're sharing it because you need to help people get this information and get updated, rather than them just staying at home and not knowing what to do. They have what they can do in order to come to the UK quickly. Thank you very much, and see you in our next video. Bye for now.